Hi, I'm Dr. Sam Alkin, an assistant professor here at Cornell University, and I'll be taking you through Module 6, where we'll be discussing what proactive COVID-19 mitigation strategies we can implement within our food facilities. When we're talking about being proactive against COVID-19, we need to remember that the practices and strategies that we put in place are going to be multi-tiered. They're going to interact within one another, and they're going to build upon each other. Now, in the previous module, we were talking about practices that we as individuals and employees could take to prevent the spread of COVID-19 within the food facility. In this module, we're going to be focusing on facility-wide programs that we should be thinking about. So things like screening programs, surveillance programs, and then how do we build programs that help support those personal mitigation practices that we talked about before. So how do we support social distancing? How do we support mask wearing and those kind of things? Maybe it's because I'm a dairy guy, but I really like this Swiss cheese model as a way to think about the multi-tiered or multi-layered approach to building a system to protect our employees from COVID-19. And it's really remembering that no single layer is going to be 100% effective. But by combining them, we can greatly reduce the risk that virus, SARS-CoV-2, that's hanging out on the left-hand side of the screen, will prevent it from making it all the way through those layers to ourselves or to our employees. And again, these layers come in different forms. Some of them are personal layers that we talked again about in Module 5. Some of these are shared responsibilities, which I would call facility-wide responsibilities, things that we can implement as companies, like testing and tracing or screening, thinking about the ventilation systems in our facilities. And then some of these things span, like how do we make these lower layers stronger within our facilities? And that's, again, some of what we're going to be talking about. So one of our first facility-wide programs that we can put in place to kind of help protect our employees are screening programs, right? The idea here is that we don't want anyone who's infected with COVID-19 or potentially infected from COVID-19 from getting into our facility. This is kind of our moat, our drawbridge, as you will. And what are we going to screen for? How are we going to do this? We're really going to be asking people on whether or not they have symptoms of COVID-19. Now, the screening questionnaires that you use for the program can come in multiple forms. You could do them on paper, or you could do them online through a computer or through a mobile phone. You need to think about when you're going to use them. Are you going to have employees take them themselves, fill it out themselves before they come into work in the morning? Or are you going to do it when they show up to the facility? Also remember that you're not just thinking about employees. You're going to want anyone who comes to your facility, so any visitors, delivery people, auditors, salespeople, to also fill out these questionnaires before they actually come into your facility and potentially put your workers at risk. Now, what are some of the components that you'd have in these questionnaires? You'll definitely have something like a temperature check and asking whether or not they've had a fever that's greater than 100.4 degrees Fahrenheit in the last 14 days. That temperature could be checked by the employee at home with their own thermometer, or it could be checked when they show up to the facility. Some companies are using infrared thermometers to check forehead temperatures, but remember that those temperatures can be impacted by the weather. So if it's extremely cold out or extremely warm out, you're going to need to figure out how to manage that. You're going to want to ask them if they're displaying any other symptoms that are related to COVID-19. So cough, sore throat, chills, body aches, vomiting, diarrhea, or have they recently lost their sense of taste and smell? These are all potential signs that an individual has COVID-19. Now, it doesn't guarantee that they have it, but it's a potential sign. And remember, these screening programs are meant to weed out people that are a potential risk. Other questions that we'd ask are, Have they been in contact with someone who has tested positive for COVID-19 or is quarantining? Have they traveled to areas with high COVID-19 rates? And we know that those areas are changing over time, so you're going to need to stay on top of those high-risk areas. In the future, you may want to consider asking whether or not they've been vaccinated or not. That can reduce the risk. And obviously, if your employee or a visitor answers your questionnaire in a way that makes it seem like they are a potential risk of COVID-19 or being a carrier of COVID-19, you're going to want to encourage them to contact a medical professional to deal with that. We've got to remember that the goal of these screening programs are to protect our workers' health and prevent the spread of COVID-19 within our food facilities. So we want to make sure that our employees and our visitors are encouraged to fill out the questionnaires truthfully. Okay, there are going to be cases where an employee has a sore throat and they're going to have to stay home, and it may turn out that it isn't COVID-19 once they go talk to their doctor, but they're going to have to take some days off, and they shouldn't be penalized through it. And they may have a sore throat a couple times a year, but we want to be cautious, right? We want to make sure that we don't actually let COVID-19 into the facility. So we're going to be a little conservative here. We're going to end up having more people with time off than maybe would be ideal, but this is the way that we protect employee health. So we want to make sure that we've thought about our sick leave policy and put in a little bit more flexibility, that people don't feel like they're being penalized for when they have symptoms. We're going to want to work closely with our public health officials and doctors to make sure people who are flagged by our questionnaires as being a potential risk for COVID-19 then get evaluated for whether or not they actually are. In these cases, because there are going to be times where people are at home, we're going to want to think about other things that they can do from home. Are there other tasks or work that they could be doing? And overall, again, we want to make everybody feel like they're in this together, so we may want to consider company-wide incentives to encourage everyone to work together as a community. So it could be like things like, we have this for workplace, at least at some of the places I've worked at. We've had, celebrations for the number of days since an accident on the work site. So maybe there is an incentive for the number of days we've gone without having a COVID-19 positive within the facility. So those are all things to think about. Another program that we should be considering, and it may not make sense for all facilities, is whether or not we should have surveillance testing for our employees to detect COVID-19. And the purpose here is, first we have the screener. So if you've got symptoms that look like COVID-19, we're not letting you into our facility. But there are individuals who are asymptomatic, which means they don't display or feel any symptoms of COVID-19, but they can still spread the SARS-CoV-2 virus. And there are individuals that are going to be pre-symptomatic. So in those first few days, you may be infected with COVID-19, but you may not have developed symptoms yet. So if we can catch them earlier, we can then prevent them from coming into the facility or remove them from the facility once we know, and reduce the risk of COVID-19 spreading. Now, there are a lot of options out there when we talk about COVID-19 tests, so it's important to understand what type of test you want to use if you're going to implement a surveillance program within your company. Generally speaking, there are two buckets of tests. There are diagnostic tests and antibody tests. A diagnostic test is really looking for an active infection of the SARS-CoV-2 virus. Now, many of these tests are molecular based, which means they're looking for the genetic material of the virus, which is only going to be present in significant quantities during an active infection. Now, there are some other diagnostic tests that are looking for antigens of the virus, so these might be components of the virus like proteins, like the spike protein, but again, these components are only there during an active infection. And the way that we do these tests, they may involve a nasal swab. It might be a retronasal swab that really goes far back there, or some use an interior nares swab, which is the front of the nose. Other tests involve just spitting into a cup. and those results theoretically can come back in as little as 4 hours, but typically take a couple days for those to return. Now, and those are really the type of tests you're going to want to use in your surveillance program. So be careful not to choose an antibody test. An antibody test, right, is really looking at whether or not your body's immune system has responded to a SARS-CoV-2 infection. And that infection, though, may not be current. It could have been an infection that happened, weeks or months ago. And so it's not really helpful for screening out people that pose a risk of carrying COVID-19 into your facility. Now, an antibody tests are a little simpler than sometimes in those diagnostic tests. It can be just a quick prick of the blood, and then the results can come back in minutes, theoretically, though sometimes, depending if you're using an outside company, just the logistics take days. But an antibody test is not what you're going to want to use. It's very helpful for epidemiologists to understand the overall transmission of the disease, but it is not helpful for our surveillance programs. Now, when we're considering testing for our facility, you've got to look at multiple factors. How much does the test cost? Who's going to administer it? How often am I going to be testing? Am I going to be testing people once a week, twice a week, every other week? What are we going to do when we get a positive? Because a lot of times, right, there's a lag time between the test and when you get the result. And so that means that person who tests positive has likely been in your facility for a certain amount of time. How are you going to respond to that? And how are you going to get them off or out of the facility? You're going to have to remember that these tests are not perfect. They have false positive rates and they have false negative rates. So they may say that someone has SARS-CoV-2 when they don't actually have it, or they may say someone is okay when they actually are not. So remember that these tests only provide also a snapshot on time, right? Whether or not somebody is infected with COVID-19, they may not be infected today, but they could be infected tomorrow. So remember that this is an ongoing surveillance program and that there are going to be costs associated with that. So think it through if you're going to implement one. Now, the programs that we have in place all interact with one another. We talked about that multi-tiered approach. An important piece is going to be implementing programs that support those personal mitigation practices to prevent the spread of COVID-19. So we'll be talking about education. We're going to be talking about ways to support social distancing besides just having our employees trying to stay 6 feet from one another. We're going to talk about cloth face coverings or masks, talk a little bit about ventilation, and then thinking broader outside the walls of our facility and the greater community. So one of the key pieces is education. If our workers don't understand what COVID-19 is, what they should be looking for, or how to protect themselves, they're not going to be able to do that. And even if you mention it once, you're going to want to have a robust training program. So you are in a training program right now. You're listening to one, but maybe, for your frontline workers or other employees, maybe you need something quicker. There are other training programs out there. We've got it's about like a 15-minute overview for frontline workers available on the Institute for Food Safety at Cornell University's website. There are also a numerous amount of infographics and signage that you can put around your facility to remind your employees about the mitigation practices that they should be taking. There's resources on our website. The CDC and FDA have infographics like the one here on the screen. And of course, there are going to be plenty of materials from your local health departments. But make sure that you're taking the time to educate your employees and that you are putting up reminders around the facility about what they should be doing to protect themselves and others from COVID-19. Social distancing, social distancing, social distancing. I'm sure you've heard it many, many times. Maintaining at least 6 feet of separation is very important for reducing the likelihood of spread. And it's going to be tough. It's tough for employees, tough for me walking around and making sure that I'm staying 6 feet away from other people, especially in tight spaces. So you should be thinking about ways that you can help support that. So number one, think about the areas. Where do we need to worry about spacing people? The production floor, our locker rooms, our lunch rooms, our bathrooms. What are we going to do in those spaces to help? That might be things like spreading out tables, taping off zones on the floor so people can visually see where if they stand here, that keeps them 6 feet away from other people. You might consider things like plexiglass barriers. That's been quite popular in some of the food industry, like meat packing. You can see here on the right hand side of the screen, there's a picture of that being implemented in a meat processing facility, and then some kind of infographics from CDC below that to think about different ways that you could put in those plastic barriers. You may also, maybe it's not always about taping things off or putting up barriers. It's about controlling time. So think about, when you let people come in for a shift and then when you let them go out, to make sure that there isn't too much overlap. Think about staggering lunches for people so you don't have crowding. And depending on the way your facility runs or the type of equipment being used, you might consider things like reservation systems so that people who need to be in a certain area of the facility or use a certain piece of equipment reserve it for a certain amount of time so that everybody knows, and then nobody else comes into that area while that individual is working there. So these are all things that we should be thinking about to support social distancing. The use of face coverings is a very important mitigation practice to prevent the spread of COVID-19. It's going to help trap those respiratory droplets. So if we have somebody who is asymptomatic or pre-symptomatic in our facility, that they don't easily spread those respiratory droplets that contain the virus to other employees. You're going to need to think about, though, what type of face covering are you going to be using? So is it going to be an N95? Are those fitted correctly for your employees? Are you going to use a surgical mask or a disposable mask? Are you going to use cloth coverings? Think about that. And then think about how you're going to supply those to your employees so they're ready and accessible for whenever they need it. Because they're going to need to change these throughout the day. They're going to get dirty. They're going to get wet. They're not going to be as effective. So where are they going to be stored so that an employee doesn't have to go walk all the way across the room to put on a new mask? What are you going to do with masks when it's time to get rid of them? Are they going to just be thrown in the trash? Is there a special bin that they should go into so they can go out for laundry and then come back the next morning? How are you going to keep track of that? So think about your mask supply program to make sure that it is easily getting masks to your employees when they need them. A system that we need to pay attention to and has received a lot of attention in the press is our ventilation and air handling system. But it's important to understand the role our ventilation system plays in COVID-19 transmission so that we use it effectively. So let's think of the case where we've got an employee who's asymptomatic for COVID-19, so they've truthfully filled out the questionnaire and are in the facility. Now, we know COVID-19 is primarily spread through respiratory droplets, so if another employee is close to the infected individual, they're at a high risk for contracting COVID-19, which is why social distancing is so important, to put that other employees out of the range of those large droplets that contain a lot of virus. And it's also why it's important for face coverings to be in use in the facility, because they'll trap a lot of those larger droplets and reduce the risk of transmission. But as I've mentioned before, no layer of mitigation is 100% effective. So even with face coverings, some droplets will escape, and some of those droplets will be smaller and thus lighter and travel much further than the 6 feet and stay in the air much longer than 15 minutes. This is where adequate airflow and ventilation systems are important. They're going to help remove those droplets and reduce that residual risk. But it's important to remember that without those other mitigation practices, the screening, the distancing, the face coverings, a ventilation system is not going to help you at all. It is part of a multi-layered approach. So I recommend reviewing your filtration systems and diving into the specific recommendations from CDC and the American Society of Heat, Refrigeration, and Air Conditioning Engineers. I will say that many of the food facilities that I've talked with already have adequate air handling systems in place with proper filters. And this is all due to the air quality requirements that we already have as the food industry. But do your due diligence and check what is going on within your facility. I know that controlling COVID-19 within the four walls of a food facility is challenging enough, and that looking to control beyond those walls might seem out of reach, but you can make an impact. Food facilities and their employees are essential members of the community and can have an important influence on the community spread of COVID-19 through their practices, and the influence goes the other direction. So it's important for food businesses to evaluate how their practices can contribute to minimizing transmission of COVID-19. Now, the housing situations of employees vary throughout the food industry, but companies should be aware that shared housing can increase the likelihood of COVID-19 transmission. Companies should consider grouping individuals who live in the same dwelling into cohorts and to minimize the contact between those cohorts to reduce potential spread. In some cases, it might even be prudent to support moving employees into housing situations that reduce density and the frequency that employees come into close contact with other individuals who might be sources of COVID-19. Of course, how you deal with this will depend on your company's resources and the community housing situations. Now, another thing to remember is around transportation. Food industry employees are essential workers and have to travel to and from work, while other members of the community can stay at home. Now, both public and private transportation have been linked to community spread of COVID-19, and travel, regional, national, international, can introduce individuals with COVID-19 into communities that were previously free of the virus. So you should review how your employees travel to the facility, whether it's in their own vehicles, carpooling, via public transportation, as well as whether or not there are employees who travel between multiple facilities that you own, if that's relevant, and then evaluate ways to modify that travel to reduce the risk of these employees being exposed to COVID-19 or acting as transmission vectors. So some examples might include providing a company car or paying for a taxi to reduce the risk for some of those employees. And again, this is just another layer to think about for your mitigation strategies, and it will depend on the resources that are available to you. Remember to be proactive about implementing and reviewing your COVID-19 mitigation practices, and that this is a multi-layered approach. These practices support one another to build a robust COVID-19 safety program that will protect your employees, your food business, and your community.